Afternoon, everyone. I'm Amy Casavina Hall. I'm a Senior Vice President at United Way of Connecticut. And on behalf of United Way of Connecticut, I want to thank everyone to join us this afternoon to come together to learn about how we can help our neighbors and navigate changes that are happening with SNAP and Medicaid. We are going to hear updates today. We're going to all learn more, and with our goal of helping as many people in Connecticut preserve and maintain these crucial benefits. Our highlight stars of the day that I'll introduce soon in turning the camera over to. But first, I'm going to do a little housekeeping is our partners at Connecticut Department of Social Services, who of course are on the front lines and are lead experts on these changes. Cannot thank you enough for joining us for what is now the third in a series of webinars as we work together in the state to navigate these changes. I want to emphasize quickly for all the folks that are on that this session is really for providers and the folks that are helping people navigate changes. We will not be discussing any individual's benefits or particular cases today on this webinar. If you individually are a beneficiary of SNAP or Medicaid or have challenges, please reach out to your local DSS for support with your case or your local action agency who's been partnering with the Connecticut Department of Social Services to help people navigate changes in these benefits. We will only be discussing policy changes and implementation, how that's working, and processes to help all of us work together to help people maintain their benefits. Again, we will not be discussing anyone's individual case. Please reach out to your support system to help navigating any challenges you are personally facing. All right, webinar housekeeping. We are in a session that is actively being recorded. Thank you very much for that. We know the recording was really popular in the slides. So again, we will be sharing out the recording and the slides to the webinar at the, just give us a day to get it all cleaned up or so, but as soon as we can, quickly after the session, we will email this out to everyone who registered for the event, and we will also post it on the United Way of Connecticut website. So please, both the recording and the slides will be forthcoming. During our session, I'm asking everyone to please use the Q&A function to ask questions. We'll do our best to answer as many questions as we can during the webinar. I will say from experience, there are a lot of questions. It is confusing, understandably. We will try to highlight kind of overarching questions and do our best to answer them, but we know we will not get to everyone's question. But we will be gathering all the questions and make sure those we'll share in them just as we did last time with our colleagues at Connecticut DSS, and they will be looking at those questions and using those to inform the frequently asked questions that are posted on their website. I will probably say that several more times during this call, but so do put your question in. It will be shared, although I don't know if we will do our best if you will get an answer during this session. We will try really hard. And very important, closed captions are an option for this webinar. They are available if you go to the menu, your Zoom menu at the bottom of your screen. Look for the circle with 3 dots in it that says More. If you click on that circle, turning on Show Captions is an option that will show up there. You hit that button to activate closed captions. I want to make sure everyone is available and knows that that is available on this webinar. All right, our agenda was we're going to open from hearing from Commissioner Andrea Barton-Reeves. Thank you for joining us. We're going to move right into then SNAP and Medicaid updates with Deputy Commissioner Peter Hadler and Director of, Dan, this always takes me a moment, Director of Program Oversight and Grant Administration, Daniel Giacomi. Okay. And then again, working Q&A in, and if we've got time at the end of the call, we will do more. It is my pleasure to introduce Commissioner Andrea Barton-Reeves. I love saying this, the founding CEO of Connecticut Paid Family Leave, who brought that initiative to life and for more than 3 years has led the Connecticut Department of Social Services, overseeing Medicaid, childcare, and food assistance for over 1 million residents and helping navigate our state through many changes, including the implementation of HR 1 and the implications for beneficiaries of SNAP and Medicaid. Commissioner, thank you for joining us.
Amy, thank you, and thank you for the warm welcome. We welcome, I think we're over 500 people, attendees this afternoon, so I will not take up a lot of time. I know that you're here to hear about the changes in Medicaid and SNAP. This morning, I think you may have seen that I was with the governor, and we were announcing a $300 one-time benefit that will go to those who have lost their SNAP benefit because of the inability to adhere to the community engagement requirements, which are very difficult to adhere to. So let's just be clear about that. You'll hear a little bit more about that, and I will turn it over to DC Hadler and to Dan, who will walk you through today's presentation. But thank you for having us.
Thank you so much.
Thank you, Commissioner, and thank you, Amy, for hosting us here. We're very happy to be able to partner with United Way to share information today about the programs that we are working to administer and the significant changes that are taking place in them. We're going to run through a couple of items, both SNAP and Medicaid. We're first going to do a little bit of overview of the SNAP program, the most recent changes that have occurred, and what we have done in response to them before shifting over to give a little bit of a preview and update on how things are evolving in Medicaid, recognizing that the changes in that program are about to begin. And we want to give some information about what that impact is looking like and how folks might be able to support clients through changes during that process. So here's the agenda, as you can see, that I just referenced. We'll also touch on a little bit of our outreach and communications effort. We have some new toolkits coming online. We'll share some information about those and where additional information can be located. And at this time, I'm actually going to turn it over to Dan Giacomi, who's going to lead us through the first part of our presentation, talking about the SNAP program and the impact that we're experiencing in that program due to the federal changes. So Dan, I'll turn it over to you.
Thank you, DC, and good afternoon, everybody. Great to be back with you today to continue our discussion on HR 1 and how we can jointly serve and assist those individuals that may be impacted by it. We can go directly into the next slide, just as a reminder of some of the SNAP work requirement changes that came about as a result of HR 1. We're going to focus a bit or more so on the right-hand side of this slide here, which shows our current state. This is something that we at the department and as the state and country have been operating under since approximately December of 2025. Individuals ages 18 through 64 who did not have a child in the household under the age of 14 and who are not exempt from the work requirements do have to provide documentation or verification that they are engaged in at least 80 hours per month of work, or what we call community engagement. Community engagement can be volunteering. It could be work training, including our SNAP employment and training program, or a combination of the three, as long as it totals up to those 80 hours per month of the work or community engagement. As I noted, there are still exemptions. We will get to those on the next slide, but as a result of HR 1, those that we highlight that were previously exempt were individuals who were veterans regardless of their discharge status, those individuals that were experiencing homelessness, and those individuals who were under the age of 24 who aged out of the foster care system at age 18. And a pretty significant or pretty large waiver that we also had, which was a geographic waiver that allowed us to waive towns or areas throughout the state that had an unemployment rate at least 20% higher than the national average. That has been severely restricted, as you can see on the screen, to only those towns or areas that have an unemployment rate of greater than 10%. As I noted in our last presentation and still remains true today, there are currently no towns or areas in the state that meet that benchmark, meaning there are no towns or areas that we can waive due to what we call lack of sufficient jobs. That said, if we can go to the next slide, please, there are still a number of exemptions, as we noted previously, for those individuals in the SNAP program. You will see a similar slide when we go over a reminder of our Medicaid program as well. But on the screen here, you do see that the exemptions that individuals can still qualify for, including being pregnant, receiving a disability benefit such as SSI or SSDI, or a veteran's benefit regardless of their unemployability or disability rating. I call that out because you will see in the Medicaid slide that it is a little bit of a different criteria for a Medicaid work program that's set to take effect in January. There's a pretty big or broad exemption category, as you see here, being physically or mentally unable to work. That is something that would have to be identified and verified through a provider. The provider could be a mental health provider, it could be a medical provider, it could be someone that you're working with as a drug and alcohol certified counselor through a rehab program, but it does need to be verified to us through a credentialed individual. Those that are going to school, those, as I kind of noted earlier, participating in a drug addiction or alcohol treatment and rehabilitation program. Those that are already meeting the work requirements for another program specific to this would be the temporary family assistance, also known as TANF or TFA cash assistance here in Connecticut. Those individuals that are a parent or a caregiver of an individual with a disability or someone who needs help with daily activities, regardless of the individual's age, and certain Native American populations or Alaskan Natives. Through each of those, what DSS will try to do is look at the information that we have available to us first through certain interfaces, such as an interface with the Social Security Administration to identify if an individual applying for benefits or receiving benefits is able to meet the work requirements or be exempt from them. If we are unable to verify that information based on what we have available to us, we will then reach out with ideas or acceptable verifications or proofs that the individual can provide to us. Next slide, please. What you're going to see on this screen here is a heat map, as we call it, of those areas throughout the state based on May 2026 data that are part of our ABOD population. This is not those individuals that have lost benefits, but this is a heat map of those individuals that are receiving SNAP benefits in each area that are subject to the 3-month work requirements as of right now. On the right-hand side of the screen, or the right map there, the differential there is it is relative to the town's population. So it may not be that there are a significant number of individuals receiving, but relative to the population of individuals in that town, they have a larger number of those that are ABOD participants or time-limited participants. We call out the 3 largest or the 3 most heavily populated on the right-hand side of the screen: Waterbury, Hartford, and Lebanon, but you will see that it is pretty significantly spread out across the entire state. Most of those on this screen, because it was May data, have subsequently closed out of benefits because they had already received and qualified for their 3 months of SNAP benefits. However, there is a smaller portion that were able to reapply or re-verify that they qualified or did meet an exemption. Next slide, please. So as I noted, what you will see on the screen here is both the total number of SNAP beneficiaries in the thousands from just prior to the HR1 work requirements taking effect, and our current recipient list as of April of 2026. So it is about 39,000 individuals in total that have lost assistance. We will note that not all of those individuals are specific to the ABOD work requirements. There were other changes that took effect as a result of HR1. One such change would be something that we discussed on our previous presentation, which is those individuals that were non-citizens that previously qualified for benefits that no longer do. There are also some individuals that are presenting to us and telling us that they no longer wish to receive benefits from the state because they have fear as to what this may mean for them or their families, whether they would be subject to deportation or other scrutiny by receiving state benefits, so they no longer wish to receive them. But what you'll see is that approximately 15,000 of our 17,000 beneficiaries that shifted to time-limited status after the changes took effect have lost benefits, while, as I said, a very small portion, approximately 2,000 individuals, retained their benefits. 10,000 more shifted to time-limited status in April, which means between April and July, they received their 3 months and are subsequently closing out of benefits as well. Next slide, please. So that's a little bit of the bad news, I would say, of HR1 and what's happening to those that we serve. We also wanted to highlight a bit of our state's response to the SNAP changes thus far through the legislature and the Lamont administration as to some of the information and benefits and funding we've been able to provide throughout the state. The first being $23 million for food pantry and emergency food distribution supports through Connecticut Food Share, the only statewide food bank in the state of Connecticut, but as well as our fantastic partnership with the United Way, being able to serve those pantries or municipalities or refugee resettlement organizations that are not part of the Connecticut Food Share Network. We do currently have an application process that is active. If you know of an organization that may qualify for those benefits, they can apply for additional funds to help stock the pantries and stock the shelves at their organization for those that may be in need. Similarly, we provided $4.1 million for HR1 navigation supports administered through our network of 9 community action agencies throughout the state. These are for individuals, for materials, and for assistance with case management, as well as identifying supports throughout the community individuals may be eligible for or may qualify for, as well as to help identify exemptions and gather paperwork to ensure individuals that are exempt or that are meeting the work requirements continue to do so and do not lose benefits for no other reason than an administrative error or issue. We provided $1.55 million through the Department of Agriculture for Connecticut grown grants. These are for Connecticut grown farms and farmers to be able to provide food throughout the community that is grown here in the state. We are currently in the middle of providing our, I believe, 11th or 12th year of summer EBT benefits. This was a program that started off very small, serving only less than 10,000 individuals, but that is now grown statewide and serves over 350,000 children with additional EBT benefits throughout the summer when they're no longer receiving school meals. And that is $42 million projected to be put into the Connecticut food economy. And most recently, just announced this morning, as Commissioner Barton Reeves mentioned, $8.5 million, which equates to $300 per person for a grocery card support for individuals that are impacted by the work requirements. So those individuals that received their 3 months of SNAP benefits and did not identify an exemption are not meeting the work requirements and are no longer able to receive SNAP benefits. They can go or contact their local community action agency to also request those benefits, which will then in turn allow the community action agency, as I noted earlier, to work with that household or that individual to identify community supports, whether it be work training programs or job placement or otherwise, that may then allow them to begin receiving SNAP benefits again, or put themselves in a position to no longer need SNAP benefits because their earnings are allowing them to survive without the need. Next slide, please. A little bit more on the grocery card benefit. As I noted, we're working with the community action agencies. We say early August, but it was just announced this morning at a 10 o'clock press conference. But in the meantime, if individuals are unable to get to the community action agency or apply for the gift card or the grocery card, they can scan the QR code, or you can have them go to 211ct.org or ctfoodshare.org to find a food pantry, soup kitchen, or mobile food assistance in their area. With that, I'm going to turn it back over to DC Hadler to...
Actually, before we hand it over to DC Hadler, Dan, we've got a couple questions that I think would be helpful just quickly to put before you. I'll start with the gift cards, which are by connecting with your local community action agency. And you can find a list of those we will post several times, but on the DSS HR1 site. Oh, I'm sorry, Commissioner, do you want to jump in?
I do. I just want to be really clear about the nomenclature. So they're not gift cards.
Thank you.
They are grocery cards, and they're not even actually cards. They are a one-time $300 benefit, and that's our fault for using card. It's a one-time benefit that will be loaded onto an app that is on most people's phones, and the cards are only for those who really are technologically challenged, because we want to make sure that the dollars are going to those that number one need them, and number two that they're secured for food security for purchasing of groceries. So that's why we did this through the community action agencies, through an app. They'll walk everyone through the process, and this is how it will work. So I just want to be really clear about that in case your community partners that are on have a different understanding of what we're doing.
That was really helpful, and I appreciate that, and I hope to not get that wrong. So that's super helpful. Is it $300 per household or per person? I noticed is a question that came
It
in.
is, yes, it's $300 per person. So you could have multiple people in a household who were SNAP eligible and are no longer because of the community engagement requirements. So, and it's a one-time benefit for each individual in that household.
One-time benefit for each individual in that household. Thank you very much.
Who qualifies? Yes.
Who qualifies?
Yes.
Perfect. I'm going to
Okay.
remember to string all those words together in that order. That's my job going forward.
All right.
Thank you.
You're welcome.
A couple questions that came in, Dan, I think you said this, but just to totally clarify, there are no longer any exemptions. If you're in a rural town without transportation or that has higher unemployment or any other thing that presents a real challenge, we know, to someone seeking employment or community engagement, there are no exemptions for that, for SNAP.
That is correct, Amy. There are currently no geographic waiver or exemptions for not being able to meet the work requirements.
Great. And then I think a final thing that we've got couple questions on, I think it's referring to the list, particularly around medical exemptions for SNAP. People have got questions about, is that a general letter from a physician? Is there a certain form? So can you just give us a moment or two on what the expectation is or what the process is on that one?
Sure. Yeah, we would accept either. So if we had a generalized letter from the professional that is signed that indicates that they are under their care and because of their qualifying condition, they're unable to work for at least 20 hours per week or 80 hours per month, we would accept that. Though we do also have a form. It is called the SNAP ABOD Work Requirement Medical Report. If you were to go to the DSS website, portal.ct.gov/SNAP, there is a link for our ABOD work rules. And within that link, there is a documents, but I can also put that in the question that I saw, where directly you can go to the URL that you can go to get that form and be able to download it and provide it to whoever it is that you're working with.
Great. And Dan, if you could also put that link in the chat to everyone, I think that would probably be greatly appreciated too.
Certainly.
Great. I'm sorry, I interrupted. Think we're handing it back over to DC Hadler.
Thank you. And I actually put a link into the chat, into the response to that particular question. So we can pull that out into the chat as well so that people can find a link to that page and you can navigate from there to learn more about the things that how to support ABODs and what kind of documentation may be required. Just wanted to do a quick check. I understood that my microphone was a little bit difficult to hear earlier. I don't know if it still is. Tried to make a little adjustment to the technical settings. Is my voice coming through okay?
Peter, you're a little echoey. I think you're coming through. It's just not super crisp.
I apologize for that. I'm not sure if there's anything I can do on the fly here, but I will try to speak closely into the microphone and hopefully my voice can carry through that way. I can also try changing my microphone very quickly to see if that helps. Just a quick check. Is this any better?
Let's try that, Peter, and let's see if we get some feedback from folks.
It's a little bit better, but now I think there's like
no background noise.
Yeah, but it's definitely better. So let's try to stay with this.
All right, I will move from here. Well, thank you all for your patience with that moment. I'm going to talk a little bit about the changes that are occurring in the Medicaid program that Dan was alluding to as we walk through the SNAP changes. Some of these will look very familiar. We want to just spend a little bit of time helping to refamiliarize folks with some of the major changes that are occurring, and then sort of the latest information that we have about the potential impact and ways that you can gather additional information to help support people as these changes become operationalized and sort of realized in our operations at DSS and with our partners at Access Health Connecticut. So we go to the next slide. Just a very quick reminder about the changes that are coming for Medicaid.
Right now, there is still no work requirement whatsoever for any element of Medicaid, but this is changing on January 1st. And in particular, this will impact only the Husky D coverage group. So anyone who's enrolled in Husky D, which is our coverage group for low-income adults without dependents, will need to meet work requirements or community engagement rules to get or maintain their coverage. What that looks like, again, is proof of about 80 hours a month of work or income, or work or income of at least $580 a month. And I just wanted to highlight that. I've highlighted this in the past if you've seen me talk about this before, because it's a little bit important. It's about the federal minimum wage times 80 hours. It is not based on Connecticut's state minimum wage. So it may be easier for some individuals to be able to point to $580 a month of qualifying income to be able to show they're compliant with the new rules. Alternatively, if work is not an option for a person, there are other ways to qualify by showing at least 80 hours of community engagement, such as community service, participation in a qualified worker training program, being enrolled at least half-time in an educational program, or any combination of those items that adds up to at least 80 hours per month. Next slide, please. So here we also have very similar to the slide that you saw earlier around SNAP. These are the exemptions from the Medicaid work requirements. People who fall into this category will not be required to show compliance. They do not actually have to do 80 hours if they meet one of these requirements. Most of these are very similar to what you saw on the SNAP slide. As Dan noted earlier, there's a slight difference for veterans. In particular, that population of veterans with a disability needs to be rated as total, or technically in the terminology that may be familiar to the veterans community, 100% Schedule R or TDIU. Another difference that I do want to highlight between the Medicaid and SNAP work requirements is that second bullet about medical frailty. This is a term that has been in the news quite a bit recently, and I'll talk a little bit more in subsequent slides about this, because it's a pretty broad category and potentially very important for people who might fall into this exemption category to know more about it so that they can show us how their conditions might impact their ability to comply with the work requirements. Very broadly, medical frailty includes individuals who are blind, disabled, have a disabling mental disorder, chronic substance use disorder, or serious and complex medical condition. As you might imagine, that terminology is fairly broad, so we've done a lot of work to try and identify what sort of conditions and treatments might fall under that category to help us identify people who might be medically frail. I'm not going to read through all the rest of these categories. You've seen them pretty much already on the SNAP slide. Just to highlight that very last one, there's a particular category called short-term hardship waivers. This is something that will be continuing to evolve. We'll tell you more about it as we get closer to January, but basically it should apply only to a small number of people, such as individuals receiving medical care out of state. Next slide, please. So I want to spend just a little bit more time talking about medical frailty, because a lot of people fall in that category potentially. As you can see on the screen here on the left, we have about 316,000 people that have been our foundational data set that we've been using to do our analysis about how we can support individuals through these new Medicaid work requirements. We've got them divided into two categories: folks that we are currently putting in an at-risk of coverage loss, and those who are likely exempt or compliant based on data that DSS already has. So there are some people in that at-risk category who definitely will be able to show that they're compliant or exempt. We just don't know about it yet because we don't have the data for it. So looking a little deeper into how we're able to support people with their exemptions or identifying that they're compliant, we have all the different kinds of categories that people might meet. As you can see at the very top, medical frailty is a big one. The way that we have defined medical frailty, which is based on a lot of information that we've reviewed and analyzed internally across other states and with partners at academic institutions, leads us to this definition that is based on claims or treatments that people have received from the medical providers. Looking back at their claims history for the past 12 months, we're able to say that people have a condition that is likely impacting, would likely meet a definition of medical frailty. So that's about 131,000 people who fall into that broad definition that you see on the right-hand side. Now there's a little bit of a nuance coming on in the subsequent slide, but I just want to highlight what the high-level medical frailty definition looks like and the fact that many people may meet it. Other categories include wage records. We do have information from the Department of Labor and IRS and certain other sources that indicate we've got about 94,000 people out of the 316 who are meeting the income requirements based on the data that we have. Again, there may well be many more people who fall in that category. We just don't have a line of sight into their income in our systems right now. The other categories might be that they're compliant with SNAP work requirements. that they're getting SSI, that they're a student, or if there are some other eligibility factors mixed in there. I do also want to note that as you try and do the math, perhaps on the left-hand side, those numbers don't add up to 206,000 because people can be in two categories. They could, for example, be medically frail and earning money. So they could fall into the wage record category because we do know, and this is a very big point that the federal government has emphasized, there are people who may be medically frail, but it is not impacting their ability to meet work requirements. So if we go to the next slide, we can see a little bit more information about that. On June 1st, our federal partners at the Centers for Medicare and Medicaid Services, or CMS, issued a really big rule interpreting and implementing the HR1 community engagement requirement. This interim final rule, or IFR, is 387 pages of detail that really sort of get into the very much all of the details about the high-level information that I was just talking about, who can be exempt and how you evaluate very nuanced elements of verification and the like. One of the biggest things that changed with this publication of this rule is that they narrowed that medical frailty exclusion, the 131,000 people that we said under our definition appear to be medically frail based on their medical history, to say not only do you have to be able to show that their medical condition is present, but that the qualifying condition significantly impairs their ability to work or meet the community engagement requirements. This is a big difference because we don't have a lot of data about what can reach that level of significant impairment. We know if somebody has a condition that they're receiving treatment for, but we don't necessarily have a way right now of gauging the severity of that treatment and whether it is inhibiting a person's ability to meet the requirements. So one of the big takeaways here is that the medical condition alone may not exempt anyone from the work requirements. We do have to use claims data from the past 12-month period to determine eligibility, including a medical frailty determination, which is good because that is what we had been doing our earlier analysis on, where we got that $131,000 number. Another important one-year component is that self-attestation is going to be allowed during 2027. So for example, an individual will be able to tell us that their condition significantly impairs their ability to work, and that will be sufficient information to be able to maintain coverage during that calendar year. After 2027, the new IFR says that will have to be documented and proven. So DSS is continuing to evaluate what this means on our ability to do our analysis and how many people we can support under medical frailty using data that we have at hand. It's very likely that clients will need to take an additional step now to meet that medical frailty exclusion. So some of those people that we previously said we had enough data to make a medical frailty determination about might fall into that at-risk bucket. And we say that because we don't necessarily know whether that significantly impairs their ability to work. Next slide, please.
And actually, can I just pause for
Sure.
one quick second? Because that felt like a really big deal. As many of us who have been kind of following this bouncy ball, when we had our last session together, there was 131,000 folks. The DSS felt like we've got good documentation from other systems. I'm kind of restating here for your correction or reorienting, right? We've got good documentation from other systems that these folks that are medically frail, that we can kind of help get their exemption from the work requirement from existing information. And since that time, the latest round of regulations dropped from CMS and seemed to shock the whole country with their definition of medical frailty and the process behind it. I believe there was just a big lawsuit, not settled in the way that I was personally hoping to. Many states, I believe, including Connecticut, sued around this. And the judge sided with CMS or OPM, or I might be getting all those things confused and wrong. But anyway, it did not go the way at least I hoped, which made medical frailty something easier to document for folks. So what I heard is that is a high standard, as we understand it now, put in place by the feds, higher than we thought for that 131,000 folks. And everyone's trying to figure out how we interpret that, and every state and your colleagues across the country, and how to meet that. And then in this upcoming calendar year, people can self-attest related to medical frailty. But beyond calendar year 27, this documentation of this still to be a somewhat nebulous term and process will go into place. So we got a year of kind of learning and navigating, hopefully under self-attestation for medical frailty, and then calendar year 28, hopefully with more clarity. this will go into effect?
Yeah.
How was that, Peter?
Sure.
You don't have to grade it, but
No,
how
Amy,
was
you
that?
did a great job. That really does sort of highlight the situation that we're in right now. And I was about to make a little reference to what you just did, so thank you for introducing it, about the litigation that was and is still underway. This is sort of one of the big challenges that states are having, is that there's a lack of certainty around about how to interpret some of these rules. And many states, including Connecticut, thought that CMS had gone farther than they were allowed to go in adding this significant impairment rule. So we, as 25 states, did ask the courts to intervene and say that CMS had gone too far beyond what their authority allowed in making that redefinition of medical frailty, or that add-on definition. As you alluded to, unfortunately, we did learn last week that the federal judge who heard the case did not agree with the states that it was such an urgent issue to be resolved. It's not over. The court did indicate that they will continue to hear the case on its merits, but for now, the terms of the interim final rule are going forward, so states have to plan towards that, because that is the current rules that we have to operate under. And that's very challenging, because as you noted this, and as I sort of started to talk about, significant impairment is not something that is readily available in data that we already have. We're going to continue to work to figure out ways whether we can identify, for example, the severity of someone's illness, and whether we can draw conclusions about that would allow them to be identified as significantly impaired. But we do expect that many people who we had previously thought might just be identifiable as medically frail, we feel confident we can identify medical frailty as a standalone concept, but we do not necessarily know whether we have information to also say that they are significantly impaired from their ability to work. And so this is very much a very challenging process. We will be continuing to plan for implementing a process that allows people to tell us that they are significantly impaired, while also trying to find data that might help to support a determination. And on a third level, we are going to continue to follow through with the litigation that was started. And this may end up getting reversed, but it's going to take a little while longer than we had hoped. So as you know, as we're talking right here, we have to do a lot of planning and work right this minute. And with that uncertainty, we need to plan for the way the rules have been written. So we are trying to figure out the best way to incorporate this significant impairment component into our process. And as you noted, self-attestation is permitted for the first year, so we can reasonably expect that that will be at least one way that people can tell us that their medical condition impairs their ability, is simply literally telling us that it impairs their ability to comply with their work requirements.
And Peter, is this 1 year kind of around self-attestation the same as the state requesting kind of waiver or an extension in delaying an implementation, or are those different things completely?
Those are two completely different things. An extension, there is a provision in the federal law that allows states to request a 1 year or a 6 month, 1 year extension of the start date of work requirements. The federal government has indicated that they are very unlikely to approve any extensions, or if they do, it will only be for up to about 2 states. So we're going to continue to march ahead and do our best, like many other states. It is very challenging, and of course, we're very concerned about the ultimate impact on people who have got to be able to comply with these work requirements and the new hurdles they might have to go through. We, again, this was not the preferred outcome of DSS or the state of Connecticut, but it is the federal law that is now on the books, and so we will do our best to comply with it in the time frame that we've been given. And just to give people a sense, because we've got this visual up on the screen of what it means to be in this at-risk population, which is a very large number, right? We're talking about 110,000 people, and quite frankly, it could be a little bit higher now because we have this significant impairment interpretation, which could broaden it. But it is, as you can see from the map, Husky D is a insurance program that covers every corner of the state. There is almost no town in the state that is not going to be impacted. Obviously, some will be in sheer larger numbers just based on the population of the town or the city. But also, as you can see on the right-hand side, where you've got a relative to the town population, that many folks are going to be losing coverage as a result of these changes, and they are living all across the 169 cities and towns and cities of Connecticut. So we really appreciate everyone who is here to learn more about this, to gather information, and recognize that no matter where you live in Connecticut, there will be residents in your town and your neighbors who will need support in trying to comply with the new work requirement rules, the new paperwork and conditions of eligibility, And so we've collectively got a lot of work ahead of us to try and mitigate some of the fallout from this federal rule. On the next slide, please. So I did, before I wanted to move away from work requirements, did want to recognize that HR 1 does change a number of other rules around the state. And one of them is coming at us very quickly. This is a change for our non-citizen population who has historically been eligible for Medicaid coverage. This is for the folks who will no longer be eligible starting October 1st of this year, include refugees, asylees, parolees, victims of trafficking, victims of domestic violence, and Afghan or Iraqi special immigrants, or SIV holders. These populations, the adults that fall into those categories, if they haven't been here for 5 years and transitioned into a different qualifying status, such as a lawful permanent resident or a green card holder, then they will lose their access to Medicaid. We estimate that right now that means about 4,000 non-pregnant adults, and I use that term non-pregnant because if you are pregnant, you actually still can maintain coverage, are expected to lose Medicaid coverage. Furthering the challenge, folks who fall into this category will not be eligible for subsidized plans on our state health insurance exchange, Access Health Connecticut. But I will note that there is still the safety net of emergency Medicaid, which is a program that is available for non-citizens who don't otherwise qualify for Medicaid due to their immigration status. I also want to emphasize that this does not impact children. Children, even if they are refugee children and asylee children, are still covered because there's an exception called CHIPRA 214, to be very technical about it. But that is the law that actually prevents children from being impacted by the changes from HR 1. And so that is our Husky A and B program. If you're lawfully present non-citizen, you can still qualify for those programs. And I also wanted to highlight that this does not impact our state-funded medical programs, including state Husky A and B for kids and our state postpartum coverage. Those are fully state-funded programs that are, again, not impacted by the federal law changes. Next slide, please. So I'm just going to spend a moment talking about some of the nuts and bolts of maintaining eligibility, recognizing that we still have some more slides to get to. I'll move through these fairly quickly so you can get a little bit more information about where we are keeping this information and how you can continue to keep up with the changes that are coming. So how are we documenting activities to meet these work rules? Again, they're going to vary a little bit between SNAP and Medicaid. But things that folks should know is that we are going to check the information available in our case records before we ask our clients for additional information. As I was alluding to earlier, for example, with the medical frailty determination, we're going to be looking at claims data and diagnosis codes to see if we can pull information in before we ask somebody for information that we might need to make an eligibility determination. For SNAP clients, there are a number of channels that you can use to provide proof. That includes using My DSS or Connect, both of our online tools. You can go submit proof and information through mail, or you can drop it off at a DSS resource center located around the state. For Medicaid Husky D clients, there are going to be new processes. These are being integrated into the existing major doorway for Husky D, which is our partnership with Access Health Connecticut. Online portal will have a lot of new questions for people to answer, for us to collect information to make that eligibility determination. And there'll be further information within that system that will show you if you need to produce additional verifications, how you might be able to submit them by uploading them into the customer portal or by submitting them by mail. Again, just want to note that important thing that Amy also highlighted, that we do expect that in 2027, self-attestation will be an option if documentary proof is difficult to locate. But in 2028 and beyond, as the rule currently stands, paper proof or verification will be required for all of these elements of eligibility. I'm going to highlight one of the first URLs you'll see here. We have a few more coming. That web address that is up there, portal.ct.gov/DSS-HR1, is where we're putting a lot of information. We're going to work to expand and enhance the things that are on that website and give people an opportunity to be able to check back in, see how the rules are changing, see where new forms and where processes are going to be updated. That should be a really good place for folks to go to stay up to date on the changes that are coming. Next slide, please. And just to give you a little preview, this is one thing that we'll be introducing imminently. This is a volunteer hour tracking form. This is to help support our partners who might be looking to support folks directly by engaging them in volunteer activities that would help them meet the work requirements for SNAP and Medicaid. This is a very simple form, and I just want to highlight that you don't actually need to use this form to support someone who might be volunteering with your organization. If you put a communication on your letterhead that identifies the person and the hours and is signed off by an employee who's responsible for supervising those hours, that would also be an appropriate form of documentation that would allow a person to be able to demonstrate their compliance or the number of hours that they contributed towards their compliance for either SNAP or Medicaid. With that noted, I'm going to pass it back to Dan to talk a little bit more about our website and some of the information that's available there and some of our outreach activities that we have been engaging in.
Thanks, DC. Though before we move on completely, there are, as Amy did to me as well, a couple of good questions in our chat that I think you can help answer right away regarding our non-citizen children. Individuals are curious as to whether or not these children will still be covered after HR 1 takes effect and up till what age limit they will be covered.
Yes, that's a great question. So any child through the age of 18 who's currently enrolled in Husky A or B, our regular Medicaid program, can maintain that coverage. If they are enrolled in our state Husky A or B program, then they can maintain coverage up through the age of 15, unless they enrolled prior to 15, in which case they can be grandfathered, so to speak. They can stay on the program through the age of 18. These are the same rules that have been in place for both of these programs for many, many years, and I just want to emphasize that they have not changed. The major changes that we're talking about here for non-citizens apply only to the adults in those specific categories, such as refugee and asylee, who are under the 5-year limitation for being able to receive Medicaid benefits.
Thank you, sir. Next slide, please. So what we wanted to highlight here, you may have seen if you're following along in the chat as well, that we did put together through work with community partners as well as our amazing team here at DSS, an HR1 member toolkit, the web address being portal.ct.gov/DSS-HR1, or you will see that there is a QR code on the screen that will take you directly to that page as well. It does provide an explanation of changes for both our clients and our partners, as well as outline steps an individual will need to take to maintain their coverage. It has information about many of the changes resulting from HR 1, not just our work requirements. It also speaks to our retroactive coverage changes, our non-citizen eligibility changes, and our work rule and changes to Husky D recipients. We will continue to update this page as we make more operational implementation steps, as more clarification and guidance is received both from our federal partners and internally, and as we finalize all of our documents. One of the questions that I did see in the chat already is where is the volunteer form, as they did not see it in the link. Right now, we're making sure we're finalizing the translation of the document so that it's also available in Spanish. Once we have the document translation finalized, we will then be putting it up on the HR1 member toolkit as well as on our SNAP ABOD page as well. And all of the other information, as I said, will be included there as well for one area or response page that individuals can go to or can direct clients to. Next slide, please. So as I noted, the toolkit itself is for both members and stakeholders, such as yourselves. What you'll notice if you go to the stakeholder section right now, it is still being built out. What you're seeing on the screen is a mock-up of what it'll look like as well. There will be partner resources, including flyers or other documents that you can use to hand out to your clients. There will be an FAQ section with many of the great questions that we're gathering in our presentations, such as today. There's also something that we're calling a virtual classroom. DC Hadler and myself were privileged enough to be able to film a version of this presentation that we will post there that you can then use or provide to staff members or other interested parties that may have been unable to attend this presentation. That gives a lot of the same great information that we're providing you here today. We also asked if you have any other suggestions of things that you find that may be helpful to put on there. Please reach out to us and let us know so that we can work on getting that up as well, because we really do want this to be an area where you can go to get your answers quickly and efficiently, not necessarily having to call our agency or reach out, or something that you can then provide to those that you're serving each day. Next slide, please. We do also have something called a pre-screener. This was something for the SNAP work requirements that we provided in our last presentation, but we're giving it again here. This is where you can go with your clients or family members or whomever. They can answer around 10 questions, and it'll tell them whether or not we believe that they are exempt from the work requirements, meeting the work requirements, or may need a little bit of additional support or information, or maybe at risk of losing their benefits, and where they can then go to receive additional information or support. It also provides the next steps if they qualify for an exemption as to what they may need to provide to DSS to ensure that we have that information on our case record and can continue the benefits beyond the 3-month period. Next slide, please. Similarly, and kind of excitingly, we also created one for our Medicaid work requirements, understanding that these are two distinct programs, but it is a simple pre-screener that you can go for your Husky D questions as well. Similarly, it's around 10 or 11 questions, and also provides next steps there, understanding that you will be providing those documents directly to our partners in our program through Access Health Connecticut, rather through our benefits center. So it does provide a little bit of different information as to where to go to get your questions answered or submit your documents. Next slide, please. And our final slide that we have for you all today, before we get to some questions, really is a call to action, or immediate steps that we can take to ensure that our clients are getting all of the important information that they may need from DSS. The first, as we talked about in our last presentation, is our Update Us So We Can Update You site, which tells individuals how they can go to provide to DSS their most up-to-date, most current address information to ensure that any letters that we send out are not sent back to us or that lost into an abyss, and that do reach the individuals that they're intended for. But the second and more importantly, or especially important as well, is identify and save the numbers, the telephone numbers that you're seeing on the screen there. There's 4 numbers there. The first you may recognize is our DSS Benefits Center. We do call, obviously, from that telephone number, but we do at times send text messages from that telephone number as well. Similarly, we have what we call short code, or 60302, which we will text any important information or program updates to individuals throughout the state. The second group is a similar process, but more so geared or tailored to our specific Husky D work rules. You see those 2 numbers obviously on the screen, 959-246-3060, and the short code 648731. Making sure individuals save those numbers in their cell phone will ensure that the numbers don't go to spam, or that if we're calling, for example, for a SNAP telephone interview, that it does not allow the call to go through, that it ensures it goes through, but also identifies that this is DSS to prevent anyone from trying to scam the individual by getting them to provide their EBT PIN information, for example. So we want to make sure that you understand that these are our trusted numbers. These are the numbers that we're providing. We'll also be doing something that we perhaps did not mention, is working with different community groups or organizations such as the United Way to identify if there's areas in which we can work together to assist those individuals that we're helping for. We had the pleasure of meeting with a few United Way groups, I believe just last week, to look at a volunteer hub portal that they are putting together to help individuals track their work hours and report them to DSS. We think that's a fantastic initiative that a community organization is undertaking here, and we'd love to be thought partners with these groups to ensure that we are all marching in the same direction, as I kind of noted a few times today, and ensuring that individuals that are eligible and meeting the work requirements or do have an exemption are able to do so. So want to take this time to thank you all for the work that you're doing and assisting those individuals, both at the United Way and throughout the state, for our over 500 individuals that have joined us here today. And we're happy to answer, Amy, if we have any questions that we're able to answer today.
We have lots of questions, and I'm really sorry we will not. There's so much detail to this, and we can never get to all of it. So again, reminding folks that we will take all the questions that come in. We'll be sure to share them with DSS, and that's going to help them inform as they're building out the member toolkit, updating that FAQ, what information goes in there and what's on your mind and what's happening with the people you serve so they can help get that right information out there. So thank you for entering. If we don't get into them, there's value in sharing your question. Okay, we're going to roll back a little bit, but I think something I said I would get to, which I haven't yet, is documentation of work hours or community engagement. How often do people have to do that? If they have to document their 80 hours, is that once? Is it every month? How often does that have to happen? And is it different for SNAP and Medicaid? Oh, I hate to even say that.
DC, Heather, do you want to start with this one?
Dan, you're welcome to if you'd like. This is a complicated question. It does vary by program, and it is one of the nuances that we are still parsing through from the IFR, the interim final rule, as it pertains to Medicaid. So we'll have a little bit more information about exactly the timing and the parameters of when someone will need to provide information in order to meet those eligible requirements within a certain window during a renewal period versus an application. It's very detailed, so I'd like to make sure we get it all in writing up on our website for people to be able to reference. But Dan, do you have the SNAP information that you'd like to
Sure.
comment?
For the SNAP program, we ask that we will check your able-bodied adults without dependents or ABOD status at each renewal. We would also ask that if you are meeting the work requirements, or I should say it's required that if you're meeting the work requirements and then your hours drop below the 80 per month, that you do have to provide verification or information to DSS that your hours have gone below the required 80. But otherwise, it would be annually at each renewal, we would update and re-verify this information. As I said earlier, there is some information that we already have available to us that you would not need to re-verify, such as if you were receiving SSI or SSDI, but otherwise it would be required documentation would need to be provided.
Great. And I know the commissioner has a question, so I just put you on spotlight, Commissioner. No. All right. I will.
Oh, good.
Okay. Thank you for sharing with us what is known, and that is endlessly deep. And then clearly what I'm hearing is there's still a lot that is not unknown, and you're waiting for more information from the federal government and are working to pass it on. So first of all, thank you for moving in a time of a lack of clarity to keep us all posted with what you do know and what is available and your best thoughts about what is coming and what things are going to be, and for having the communication loop keep coming as things come down and you process it and share it out. Thank you for building out more information and resources that will be available on the website. I know people are super eager for that, so that's super exciting. Lots of questions about substance abuse, right? And being involved in treatment and like, is there an approved list? And what does that mean? So I know we didn't get to those, folks. We heard you. We'll work on getting answers to those. I'm sure a lot of depth to those also. And I think I want to thank DSS team enormously for being here again to do this work and to share and help us stay informed. And I want to thank everyone on this call. A lot of answers we don't like, not enough of the answers we want, but everyone is working together to figure this out and do the best. And thank you for being part of that massive helping network in Connecticut. That is helping people navigate these changes and preserve benefits and apply still for benefits, right? For people who are eligible for SNAP, applying for benefits, applying for Medicaid. These are life-saving benefits that our team at DSS administers. They don't set all the rules, but they administer them, and we are part of the network of help to make sure people get them and maintain them. So thank you, everyone. Recording will come out, slides will come out, follow-up information will come out, and we will see you again soon. Any final words from our friends at DSS?
Thank you.
At 2:01, thank you. At 2:01, we will say goodbye. Thank you, everyone.